What are things people are doing that may be causing them to be more likely to have back problems? And then what sort of things do you recommend as prevention when you're young and healthy to avoid those things?
You said something really important. Best to start as soon as possible. Sort of like if you want to keep a car forever, you want to start taking care of it from day one. So the time to start is today. And I know it's hard because I've not started either, even though I have great plans too. But the most important thing is to be really healthy and fit, because 1G of gravity on planet Earth is a lot more than you think. There's a reason why we use the term dead weight. You try to pick up 150 pounds, like a sack of rice, you'll be surprised how heavy it is. But I weigh about 150. Every time I stand up, I'm just throwing around that weight. And the discs, the facet joint cartilage, are just like the treads on your tire. They're going to wear out. The question is how fast and what can be done to mitigate it. And my guess is that the most important thing you can do is to be really healthy and fit so that all the muscles that surround your spine are not only like strong, but more importantly, coordinated. So that as you just literally just bend over to get something, an incredible amount of pressure goes through your discs from all the weight that you're putting on it. And if the muscles are working in a way that redistributes all those loads across all the 5 discs, it'll probably last longer than somebody that is really uncoordinated. And it's going to basically find the weakest disc and then just keep going down that road.
Yeah. So when you bend over to pick something up, like keep your back straight and use your lower extremities, sort of stuff.
And use the muscles in a way that redistributes the loads to do that. And the way to do that is to exercise so that those muscles are used to it.
So what are some good exercises that people can do, particularly to strengthen the muscles around the spine?
Everyone focuses on just strengthening the core, and it's mostly the abdominals. But I found that that's not that helpful. What's more helpful is to help them find an activity that they enjoy doing, because this is like watering a plant. You have to water it on a regular basis. You can't forget about it for 3 months and then expect it to do well. So that's what I really focus on, a customized exercise program. And you can tell how much work that requires. That requires a really good physical therapist to get inside the person's head, find out what they like and don't like, and then leverage that information to find an exercise program they can do on their own for like until they go to heaven.
So if someone doesn't,
and it's hard.
If someone doesn't have access to a physical therapist or like specialized care, how can they sort of design their own program? Like what sort of exercises should they look for in terms of, is it just core strengthening, and core meaning the whole core, not just abdominal? Is it back, chest and back? Like what sort of things should they focus on? What areas of the body?
I'll tell you what I do for most of my stuff. And when I want to do something, I hardly ever like go to classes or hire coaches. I just open up my phone, I start looking through social media, and I find a lot of guides on all the different exercises. There's so many out there. I don't have any that are just popping to my mind, but there's a lot of really good exercise physiologists that can help you develop a program. But you know what I noticed? For most of us, what you need is like a little, I don't know, a buddy, somebody that you're kind of, it's like a consequence buddy. I can't remember what that's called, but
accountability buddy.
Accountability buddy.
Yeah.
You need to find somebody that is kind of wanting to start getting fit and going down the same journey as you. And it can't be your spouse either. It has to be somebody that if you kind of like let them down, you're going to feel bad about it.
That's true.
Because they will get you there.
But I will say that my husband and I go to the gym together and lift weights together. And it's actually fun for us to do together as a couple.
You lucky devil.
Yeah. So sometimes you can incorporate your spouse, but yes, I could definitely say, no, I don't want to today, and make him go alone. And I won't feel bad about it.
See, that's what I'm saying. He's got to leave the house and make you feel so guilty. You're just going to say, I'm coming, forget it.
Yeah, exactly.
Because once you get there, it's amazing. You'll get a good workout. You just got to walk in the door. That's the hardest thing.
What about injuring yourself working out? Because we see that, right? Especially people who do a lot of weightlifting, or even a large amount of endurance exercising, they can injure themselves. So how can you protect yourself when you're doing the thing that you should do to help your spine health overall?
That's one of those questions that I have no answer for, because you're just going to get injured intermittently. Probably the best thing to do is to have either a coach or a partner that can objectively see what you're doing, and if you're overdoing it, kind of hold you back, because it's really hard to self-regulate. Since I'm not very good at that, I keep a journal. So just keeping track of the activities that you do, because sometimes you may overdo something and not realize it for 2 or 3 days and think like, I don't even know why this is happening, because a lot of my patients will start a really good exercise program or good PT program. They'll have a flare up and they'll conclude that PT is bad for you and just completely stop. Instead of trying to identify what part of that PT was probably not right for them, backing up and regrouping and keeping on with this journey of finding this kind of perfect program for yourself, because it has to be customized. I noticed there's no single program that works for everybody.
And backing up in terms of like listening to your body pains and saying, okay, I should stop for a few days, a week, till the pain goes away. Like how do you, or going back on the amount of time or the weight amount that you're lifting if you're lifting weights?
Yep. Oh, by the way, I tell my patients all the time, if the little voice inside your head says something about this is not right, I want them to listen to it. And I even want them to tell their therapists and their coaches, like, I don't know what it is about this, but something doesn't feel right about it. Dr. Kim told me to tell you, say that.
Yeah.
So I don't know why, but that's pretty important. So I would listen to that. But in terms of trying to avoid injuries, you almost have to get injured every once in a while to figure out what injures you, because I'm a big believer in trying to constantly get better. Because one of the other weird things is that the body gets used to a certain exercise. So if you do the same exercise all the time, after a while, it's not that helpful anymore. Like I do 50 push-ups every night. I don't think it's helping me anymore. I need to do something different, because my body's somehow gotten used to it.
Yeah, or change the way you're doing push-ups.
Yeah, and it's like really efficient now.
Yeah.
So it doesn't really help me.
Yeah, that's a good advice. I will just share a story. So I developed a labral tear in my hip, and and it was quite painful for some time, but I was still able to ambulate and do my normal activities. But I did, slowly, I backed off on the exercises that would really strain that joint. And then as the pain got better, I started to do them at lower weights. And now the pain is almost completely gone. It rarely flares up. Because I think I've strengthened the muscles around the joint there. And so I think that's a good advice in terms of like, take it easy. Like, okay, it's okay if you have to stop a certain exercise. Like it's not the end of the world. You can do other things to continue to strengthen and slowly build back up.
Yep. I mean, if I had to just recommend one like kind of parameter, is to back up 50% of what you were doing and then just go up 10% per week. And you keep track. For some people, it'll just be 10% per week. Some people will be like, I want to do 20% next week. And some people, it has to be 10, 20, and then 5. So unfortunately, it's so different. All my patients just want like, give me a number. It's like, well, I can give you a number, but it's probably not going to be accurate. If you keep track, that number will be your number. And that's the number that we want to go after. And by the way, I'm a big believer in the future of healthcare has to be customized.
Absolutely.
Including our blood tests and things like that.
Yeah, I think it's interesting. We had Andy Galpin on the podcast, and he's like, when you look at our normal values, they're standard deviation of 2 or whatever. So you can be from 10% to 90% and be in the normal range, but that may not be optimal for you. And I think it's really important to sort of assess what works for you will not work for everybody else. And trusting your own body as a guide is really valuable. Yeah,
I think when we have like kind of continuous monitoring, that'll make it a lot easier, because then you can use your own history. And if you can then enter information like, I had a really good day today, I felt really run down, and you just start gathering up all that data just on yourself, just through history, I bet you're going to have information that is much more pertinent to you. You don't have to wait until you're really sick.
I think it's good. I think sometimes it leads to unnecessary anxiety, continuous monitoring. Like you might see a blip in something, right?
I can see that.
And you're like, oh my God, this went off today. And now my whole, what does that mean? And spending a lot of energy and anxiety on that one thing. I think generally looking at how you overall feel, knowing that there's going to be aberrations day to day, your hormones change day to day, your whole body changes day to day, depending on the stress you're exposed to and the sunlight you're exposed to and everything, right? Like how well you sleep the night before. So I think there's so many factors, and to figure out what exactly minutia you need to change is going to be very difficult. And probably at the end of it, sleeping well, getting good exercise, staying hydrated, like the basic things will always remain true to improve your health. So in terms of, acute pain, acute back pain is very, very common. Like you get injured, something
all
happens.
the time.
But the good news is, at least to my knowledge, is that very small percentage of people with acute back pain go on to have chronic back pain. And I think we've talked on, what can you do in the short term in terms of pulling it back, but are there other things you can do diet-wise, supplement-wise, when you're in the situation of having an acute episode of pain?
The number one thing is being really healthy and fit, where the muscles that surround your spine acts like the world's greatest back brace, so they're both strong and coordinated. And then the rest has to do with being really healthy in general. And if there's one thing, it has to do with the inflammatory system. I would say that most Americans, including me, were all in a heightened state of inflammation relative to the way we probably were 20,000 years ago. And it's because of our lifestyle. We don't exercise enough. We don't sleep properly. We eat really highly inflammatory food. We don't fast enough. And then I think 20,000 years ago, we basically evolved to go from periods of terror and then sheer relief. We didn't have this kind of low, never-ending kind of, I have to work on my thesis or build up my career that is just constant without these. Because the great thing about today is that we don't ever get terrified that a saber-toothed tiger is going to jump out and eat us. But we need that. I think the people that are like these extreme athletes, they have to live like that because they kind of are in that end of the spectrum. But I think all of us are normally designed to have terror relief, not this low level of stress. So this low level of stress, sleep deprivation, and a highly inflammatory diet in the setting of lack of exercise, a lot of the disorders that we have, I think, the chronic ones are inflammatory. And my thinking is that patients that have an annular tear that are symptomatic are simply those patients that have that episode of back pain for like 2 weeks. They have an annular tear, but that annular tear kind of heals. And when you get an MRI a year later, it still looks like an annular tear, but it's asymptomatic. But the group of patients that remain symptomatic with chronic low back pain, the inflammatory system has never turned off. It's just chronically on. And if you're wondering, I wonder if that happens in other areas of the body. If you've ever had tennis elbow, golfer's elbow, plantar fasciitis, shin splints, IT band syndrome, rotator cuff tendonitis, those are all chronic inflammatory conditions where the inflammatory state is just stuck on the on position, and they are painful. Yeah. I've had most of them, and they last forever. And if you image them, you can hardly tell something's wrong. And the surgeries to treat them are really just to go in there and muck things up and essentially start a new healing reaction so that hopefully this time around it'll go down the correct path. But this whole inflammatory system, I think, contributes to higher incidence of chronic low back pain, and chronic neck pain, and joint pain, and a variety of other things. So
how do we, outside of sleeping well, getting good exercise, eating right, what else can we do to reduce our inflammation?
I think you said there's 5 things. So there's exercise, good sleep, good nutrition, stress management, and what is the 5th thing? That's a lot, though.
Yeah.
So this is why it's so hard. I mean, those are really difficult problems to tackle.
Yeah. What about, we hear a lot about yoga and back pain. How does yoga specifically as an exercise benefit people with back pain or prevention of back pain for that matter?
Yoga is awesome because it's an exercise where you don't put yourself at risk for injury that much compared to like kickboxing, which is what I like. There's stretching involved and there's meditation involved. The problem is, like, I couldn't do yoga myself. I couldn't do it. It seems too boring or too awkward or doesn't fit my image. I don't know what it is, but like my wife does this hot yoga, my PA does this hot yoga. I have zero interest in it.
Yeah.
So part of it is the best exercise is the exercise that you actually enjoy doing, and then you take that activity and you kind of like make it kind of safe. Yeah. And then add into it cross-training activities so that you can get better and better and better without injuring yourself.
Yeah.
That's the most common message that I try to get across to my patients.
That's good. You mentioned fasting. How do you think fasting helps?
I'm not sure, but my wife is a vegan and she has like time restricted eating and she's really healthy. And I've been making fun of her for like 30, 40 years. But the last 5 years, she's doing the mic drop all the time because now it's paying dividends.
In terms of like no aches, no pains, that sort of
yes,
stuff. Yeah.
Healthy skin, never gets a cavity, never catches a cold.
So you think that there's some benefit in terms of reducing inflammation for fasting?
Oh, yes. So fasting and a low inflammatory diet, I think is, if I had to guess, the second most important thing to do. Exercise, followed by our diet.
And what would you avoid for a low inflammatory diet?
The most inflammatory things are mammalian proteins. So my favorite, a big, fat, juicy steak. It is terrible for you.
Yeah.
But I can't help it. Or a good burger. So cheese, these are all my favorite foods. Red meat. I'm not a big dairy product person, but a lot of people love dairy.
Mm-hmm.
Those are all the worst things you can eat. Despite what everybody says, but it's true.
I know a lot of the carnivore diet people are going to come after us, but there's a lot of data there.